deadly strain of avian influenza.
Suspected bird flu outbreak.
Bird flu hits California.
Avian influenza outbreak.
First described in 1878, what we now know as avian influenza has become a threat to domestic and wild birds and mammals worldwide. But how does it spread, and why is it so difficult to control? The disease fowl plague was first described in 1878, but this was long before the cause had been identified. It wasn't until 1930 that an unknown influenza virus was isolated from a pig infected with swine influenza. This type of virus, the influenza A virus, is now known to be the cause of fowl plague, or as we now call it, avian influenza.
The severity of avian influenza depends on the influenza virus itself and on the immunity of the bird and also the health status of the bird. Avian influenza viruses are described by the severity of disease that they cause, because this is directly linked to the impact on poultry farming, and it also affects the way we manage the disease. Avian influenza is characterized as low pathogenicity or high pathogenicity. Low pathogenicity avian influenza results in fairly mild disease in healthy birds, sometimes so that signs can't be seen, whereas high pathogenicity influenza causes a very, very severe disease in poultry. Sometimes all the birds in a flock might die within 24 hours. If birds are vaccinated, they will be resistant to disease and show much milder signs. The subtype we hear most about today is H5N1, and the reason this virus is so well known is firstly because of its impact on livestock. It's been responsible for the death of hundreds of millions of birds worldwide, and it's also affected cattle in the United States. Secondly, because of its impact on wildlife, it has decimated wildlife populations around the world. It has been responsible for infections of multiple wild mammalian species, and in wild birds it's reached every continent of the world, including Antarctica. The third reason we're concerned about H5N1 is because of its impact on public health. There have been sporadic human cases, and there's a real concern that if this virus adapts well to humans, it could be responsible for a pandemic. Influenza viruses evolve rapidly, so it's important to continuously monitor them to ensure that vaccines are kept up to date with circulating viruses.
The current lineage of avian influenza H5N1 that we are most concerned about was first discovered in China in 1996. At the time, it caused outbreaks in poultry and was associated with sporadic human infections. The outbreaks initially appeared to be under control, but it resurfaced in 2003 and spread throughout Asia. Between 2003 and 2005, H5N1 spread to Africa, the Middle East, and Europe. As the virus continued to circulate, it evolved into different groups and genetic lineages, which have since been found all around the world. Between 2005 and 2021, avian influenza continued to circulate in wild birds and in poultry. There were also sporadic human infections, which remained a major cause of concern because of its pandemic potential. Then, around 2021, its behavior changed. We started to see massive die-offs of wild birds and infections of a broader range of wild and domestic mammalian species. Since 2021, avian influenza has caused unprecedented wild bird die-offs, gravely impacting biodiversity, and was responsible for the death of hundreds of millions of poultry. It has been reported in more than 100 countries and territories, even as far as Antarctica, leaving no continent unaffected. In the past 4 years, we've seen a broader range of mammalian species affected by H5N1 avian influenza. Most recently, in 2024, new patterns of spread have been seen in dairy cattle in the US. Sporadic human cases continue to occur, mostly associated with infected animals or contaminated environments. WOA assesses the human risk of infection as low.
Over the past 4 years, we've seen a significant change in the behaviour of H5N1 avian influenza. Surveillance, early detection and reporting are essential for informing both animal and public health. We also need to think about vaccination as a complementary tool to biosecurity, to protect global food security, and to preserve biodiversity.